This segment of CoastLife is sponsored by Beebe Healthcare.
Well, not only has it been an extremely cold winter so far here along coastal Delmarva, you've probably heard a lot of in your office and known a lot of people that have come down with the flu lately because flu season has just been awful. So to kind of give us some healthy tips to stay healthy, remain healthy, or if you are feeling sick, what you should do about it, we've got Dr. Ryan Arias with Beebe Healthcare joining us today, medical director of the walk-in care. So Dr. Ryan, you're seeing a lot of flu-like cases coming through that walk-in, aren't you?
Oh yeah, there's a ton coming in. It's all flu A. The majority of it is flu A. And we rapidly test that at the walk-ins. It's a quick nasal swab, I was looking at some CDC data just a few days ago. This is the worst flu season we've had in approximately 15 years.
That's what I heard.
And it's out there. Delaware's I think we're in the very high or bordering on getting to the very high category. So there's a lot of flu out there.
Yeah, there is. And I'm glad that you said it's type flu A, because I know there's also, people are worried about bird flu. People are worried about different types of the flu this year. So what sort of symptoms maybe should people be on the lookout for to tell you that this is the flu and it's not just a regular, viral illness that'll pass in a day?
Yeah, so the flu is a febrile illness. So fever is usually the hallmark. That doesn't mean you can have the flu and not have a fever, so that can exist. But it's a febrile illness. And really one of the big hallmarks is you're fine one day, and the next day you're sort of absolutely tanked.
Gotcha.
You feel terrible, you've got chills, you've got body aches. Those really clue us off to say, this is kind of looking like the flu.
Yeah, and when people are feeling those symptoms, would you encourage people to go to the walk-in rather than just rotting in bed and hoping to get better?
Yeah, so I mean the real hallmark of treating the flu is a couple different ways. One, it's rest and fluids and trying to keep down food if you can. Now if you're nauseous and you're vomiting and you're really feeling junky, you should definitely come in, right? Because we have other things that we can use to treat the flu. One of the things is called Tamiflu, and that is a shared decision making between you and the clinical provider that you see.
Okay.
Sometimes you're eligible for it, sometimes you're not. It depends on the window. There's a lot of different sort of quirks with Tamiflu.
Gotcha.
We usually like to give it within the first 24 to 48 hours of onset of symptoms.
Okay, so as soon as you're feeling kind of that rundown, fatigue, the fever, maybe it's a good time to pop on into the walk-in with Beebe and then figure out what the best plan of action is so that you can get back on your feet and not feel so terrible for so long. Because I know the flu, it can last up to a week.
Yeah.
For folks who I know we're kind of late into winter and flu season, and maybe they missed that initial round of the flu shot, can they still get it? Should they still get it? When is really the ideal time that people should get the flu shot? Because we know it is more of a preventative measure.
Yeah, and it's exactly that, right? So the CDC always recommends anybody 6 months and older, you should get your flu shot. There's really no time frame for you not to get it. You can always request it wherever you go, a pharmacy, your office, your primary care, any of those places offer them. As far as the best time to get it, because it is preventative, you really want to try and get it around the October time frame.
Yeah. Okay, good to know. I know there are also a couple of myths still floating out around there about the flu shot, that it gives you the flu. Some people are like, I feel so much worse after the flu shot, I'm not getting it this year. Is that the case?
No. When you get the flu shot, the virus is completely inactivated. It's actually just a bunch of proteins, and your body's smart and it recognizes those proteins, and so it actually helps you later on when you encounter the flu to not have such severe symptoms. So that's why people who can come in, I don't have a fever, I don't really feel that bad, I just feel kind of junky, but they test positive for flu, it's probably because they got their flu shot and it's not as severe now.
Okay, that makes sense. Is there anything else that people can do, maybe some other preventative steps that they can take to try and not come down with the flu at this point in the flu season, especially if they didn't end up getting their flu shot?
Absolutely. The biggest thing, washing the hands. Going around, washing your hands, and then wearing your mask. If you know that you've got some, kind of lung pathology, you've got asthma, you've got COPD, you're prone to getting coughs and colds. You should, if you're out in public and there's a lot of people around, you should wear a mask. Simply because the flu is a respiratory virus, but it's also a droplet virus. The virus lives on surfaces for up to 4 to 5 hours after droplets have accumulated there.
Yeah. Okay. Oh, ooh. Well, Dr. Arias, before we let you go, where are some of your walk-in locations so that if people are feeling a little run down, a little achy, a little fevery, they can come check you out?
Yeah, great question. So we have several locations, and we're all along Sussex County. One of the newer ones is over right here in Milton. We've got one in Rehoboth off of 24. We've got one down in Millville off of Route 26. We've got two off of the 113 corridor that are currently open, Millsboro and Georgetown.
Perfect. There you go. And what do hours look like for the walk-in clinics as well?
All the walk-ins are open from 9 a.m. to 7 p.m. If it gets real busy at 1, we do have the flex capability to say, hey, if you want to shoot down to Milton, their time isn't as long, and then they can set you up an appointment with there as well.
Awesome. A lot of resources for you out there to stay healthy for the remainder of this flu season. Well, Dr. Arias, thank you so much for coming in and telling us how to keep ourselves, and remember, reminders to wash your hands, bring the hand sanitizer with you, mask up if you're feeling run down, and stay healthy out there. But thank you once again.
Appreciate it.
Coming up on Coast Life, though, we know there's always lots of questions buzzing around when it comes to the world of real estate. We've got some answers when we get back.